Hey, it is Dr. Myers, Dr. Derm. Acute urticaria or hives are something that we see quite often. In fact, acute urticaria I once heard was the most common reason to go to the ER for skin issues. So it's really alarming to patients because it can be on them, it can be on their kids. It comes out of nowhere. It can spread really quick. The definition of short-term hives is this welt has to come and go within 24 hours. So most of them even come and go within 12 hours. That doesn't mean that you're not having hives elsewhere. It's just almost like they're migrating. It's like if you could watch Pangea on a globe happen super quick. Like instead of over millions and millions of years, you could see it over a second. That is hives. So what do they look like? They're either red or pink. They're raised flat top, and I love to call them welts because people really resonate with welts, but they're welts that weren't caused by any hitting or trauma or whatever. They're just basically from within the body. So the body freaks out due to some stimuli. The first cause, number one, that we tell people is the category of idiopathic. Idiopathic, I'm an idiot, I'm pathetic because I can't figure out why you got hives. It really means we can't figure out the real reason that you got hives. We never identify the exact reason. Right after idiopathic would be a viral eruption. So the hives don't necessarily have the virus in it, but say you have an upper respiratory infection or a throat infection or some type of viral malady, this can kick up hives. Basically, somehow the body's reaction to the hives triggers this release of histamine from mast cells on the skin, and you get these welty hives over the trunk and in the body primarily. So the rest of the reasons for acute urticaria are a lot less common. They're the bottom 20-25%. And so it can be a whole list of things. It could be because of antibiotics. It could be because of a bacterial infection. It could be the start of an autoimmune condition. It could be rarely foods. It could be rarely a topical like latex thing where a local urticaria kicked off a global urticaria, and a few other less common causes of hives such as bee sting or something like that. So all these are the lower 20-25% of acute urticaria, but you have to put them on the list. But most of the time it's either idiopathic or a recent viral infection. How do we get hives? What the heck happens? So this immuno response to something triggers in the body where you basically have mast cells in the skin release a bunch of histamine in a localized area, and thus that skin takes in fluid real quick and welts up. And as the body has ways to calm down this overproduction of histamine from these mast cells and calm down hives, it can be popping up and welting in other areas, which is how hives happen. And most patients we see, it kind of comes and goes and comes and goes over days. Usually it's not weeks and weeks. Most people, it's going to be days. And that could be 1 day, it could be 7 days. You're kind of in that range for the vast majority of patients with acute urticaria. Chronic urticaria, long-term hives, longer than it's been going on longer than 2 months. That's a whole different animal. It's super rare. We do see it and we take care of it, and there's cool medicines for that, but that's for a different video, different time. These hives are super itchy. That's one of the biggest complaints. So topically, you can use anti-itch lotions such as like Sarna or any of those lotions that have menthol and camphor, things to just give you a short-term relief of this itchiness. Most of the time, we just have to tell patients this is going to get better. Our treatment, the mainstay of treatment, is non-sedating antihistamines. So these are basically like Zyrtec, Allegra, Claritin, Xyzal, or their generic counterparts. And those basically, without making you tired, they can basically attenuate the amount of histamine released from the mast cells. And that's what you want. And commonly we'll use a double adult dose, even 4 times a typical dose for an adult. And that's a common thing that we do in dermatology. It's actually very safe. If you split that up and do 2 in the morning and 2 at night for short-term hives, that's a common thing we use. Again, you can start with just a double dose of what your typical non-sedating antihistamine dose would be, but if need be, you can go up to 4 times a typical adult dose for urticaria, which is much more histamine than a typical allergic rhinitis or stuffy nose type of a overreaction. We do also occasionally use like topical steroids if it's super itchy on top. Most of the time that's not needed. We do also offer something like Benadryl at night. I don't like Benadryl during the day because you feel all snowed and feel tired. So I love the non-sedating ones during the day. Benadryl steroid works great. In fact, it probably works better than non-sedating ones, but not so much that you need to be tired all day. So save those for night and do the non-sedating ones during the day. That's a great kind of combo if necessary. There's another one called hydroxyzine, which is Atarax, and that's similar to Benadryl. It is a full antihistamine, but it does have that side effect of somnolence also, or tired. In the past, we used to recommend other antihistamines such as Pepcid and even antacids or certain H2 blockers, but most of the time I just do the oral non-sedating antihistamines and they do great. Occasionally we'll also do like a short-term oral steroid like prednisone, or like a steroid injection that lasts like a week and a half. This is basically quickly quelling the urticaria, the hives, until your body quits flipping out and causing these. You're basically buying time by quelling the overactive immune system until your body is regulated again. And it almost always self-regulates. Most patients, we don't have to do these oral prednisone or these, steroid injections, but it is an option for those who have severe reactions. So there's a little subtype of urticaria called angioedema. Angioedema is only 10% of acute urticaria patients. So not only can you have hives on the trunk and the arms, but you could also have hives on the digits and even on the lips and near the mouth. Angioedema, though less common, in rare cases, there is a subtype of angioedema where your throat closes. And that's an emergency. You would need an EpiPen or some epinephrine to open up your bronchial tubes that are kind of closing down. So certainly this is something you need to call 911, you need to go to the ER, or you need to drink or take a significant amount of Benadryl to calm down this angioedema subset that is closing your bronchioles. You're having bronchial spasm, you're having constriction of your air tubes. So there is another little subset of urticaria called physical urticarias. These are less common and they're a little more resistant to non-sedating antihistamines, but physical urticarias are non-allergic, so they're caused because of what's called physical processes. One common one's called cholinergic urticaria, and that is hives due to sweating and exercise. You can have cold urticaria, where if you put an ice cube, the patient will welt up underneath. So you're basically the mast cells are releasing histamine only in one specific area. You can get that on your fingers or on your lips of people that have cold urticaria, or when they go skiing, when they get snow skiing, or if they get out of a hot tub, they can have this swelling of their limbs because it's far away from the heart and it's suddenly cooling rapidly. You can have aquagenic urticaria. Water hitting the skin can cause your skin to hive. So another type of physical urticaria is one called dermatographism. Dermatographism is the most common type of physical urticaria, and it is skin writing. When someone scratches their back, or if you actually, do an X or write a word on the skin and it welts up underneath where the pressure has been, that's called dermatographism. So dermatographism, just like the other physical urticarias, can get a little bit better with higher doses of non-sedating antihistamine, but a little more resistant than your typical acute urticaria are to those medications. So that's the main stuff. That's my long version for acute urticaria. Your body is incredibly smart and it knows how to reverse this short-term overreaction of histamine released from mast cells on the skin. You usually don't even need our help, for those who do. Fortunately, there's a few little tricks we have, and certainly we can give guidance and help people through that. Hey, thanks for watching. Love when you do. Like it, subscribe, keep coming back for more. You're awesome. Thanks.